Hey guys, and welcome back to Exo Medical Spa, and welcome back to another episode. First, I'd like to thank everyone for tuning in again. All the videos are getting great responses and great comments. And then it seems like you guys all love to hear about PDO Threads. So that's what I want to focus on again today, because that's what you guys want to hear. Now, in regards to what's going on here at the office, we're still doing a lot of trainings. I personally am still trying to find a house. Almost closed on another one, but you guys know how the market is. So if you guys can pray for me. Thanks a lot. If you guys can give me any info on tips on how to buy a home, then leave a comment in the description below as well, okay? But in the meantime, don't forget to give it a thumbs up, check our introduction on our trainings, and I'll be right back and let's talk more about PDO. I personally like to diversify on what I speak about here. I like to speak about what happens on here in the clinic during the week, questions I commonly get as well. But in regards to that video we posted last week, man, you guys love PDO Threads. If you guys check out our other video from last week when we talked about PDO Threads, we talked about what are the uses for PDO Threads, because we always commonly know it's used for lifting or the purposes of lifting. But we also talked about other places where we can use it. So definitely go check out that other video. But today, one of the concepts I want to address is pain. I hear very, very often people are afraid of PDO Threads because of the fear factor of the pain. Fillers, people are worried about lip fillers. Botox, people are worried about pain as well. But ironically, I feel PDO Threads is one of the most comfortable procedures you can do. I think it's even more comfortable than doing Botox. And I'll talk about why as well. But I'll relate it to when I do a lot of trainings and how even the providers have issues with pain control for their patients, or how do they treat appropriately to reduce the concept of pain or the feeling of pain and the feeling of anxiety when it comes to pain, when it comes to their clients when we come back. When a client or patient comes into me and they talk about, I want to do PDO Threads, but I'm worried, I'm scared, I heard it's very, very painful. And the response I give to them is absolutely it's painful. If you read the reviews on Google, Real Self, or other common review sites for medical procedures, one of the common things that people say it's a very, very painful procedure, and absolutely it can be, but it depends on how the provider treats it. When I talk about Botox, fillers, threads, and I mentioned, and even on our previous conversation where we talked about pricing, it's not the Botox that's painful, it's not the filler that's painful, it's not PDO Threads that's painful, it's the person who's doing it. It's the person who's holding the product and doing the procedure. If they don't know how to do it right, if they're new in the industry, if their technique is, I don't want to say wrong, but if their technique isn't geared towards being comfortable, then that's what makes the procedure painful. So we talk about PDO Threads or any other procedure. My concern is safety. My concern is pain. Granted, I can give you the best procedure in the world and it looks wonderful, but if it's to the point where it's so painful and it's not worth it to you, you'll never come back. If it's painful, you're gonna have a bad experience. So I can do anything one time, but if your experience isn't good, then you'll never do it again and your results will eventually fade over time. Botox, fillers, threads, I don't make it comfortable, you'll never come back to me. Now this is where technique and the numbing process is so crucial to me. When I do my trainings nationally, I always ask if the patient or if the provider's experienced, how do you numb the patient? How do you make them comfortable? And I'll get a whole range of it. Topical numbing, I'll do local injection sites, we don't numb at all. So I hear a whole range of it. And when I train, I tell them, my way is not the right way. I can learn from you guys as well, but this is how I personally treat. My goal is to make the patient as comfortable as possible for those reasons we just talked about. So if the patient is comfortable, a couple things happen. One, we talked about it, patient will come back. And then two, I can safely treat and efficiently treat the patient as well. So imagine if you were a patient and you came in and the whole time you were uncomfortable, grimacing, clenching, moving, taking a whole bunch of breaks, that is unsafe for you. If I'm having a whole bunch of needles towards your face and you're moving and fighting and grimacing, that's not safe for you. Second part of that is if you're comfortable, I can fly through the procedure pretty quickly. Expediency means for me less mistakes. Expediency for me means that I have to use less numbing agent. If I'm putting less lidocaine in you, less epi into you, less chemicals into you, it's also a safer treatment for you, and you don't leave the office very, very swollen. I have a couple ways that I can treat this, and this is how I preserve pain. I'll ask you, I can do this one of two ways. One, I can use a limited amount of lidocaine if you have a high pain threshold, and we can go through the procedure and you don't leave the office very big and swollen and very numb. If you can imagine when you go to the dentist office and they numb everything, you just feel very weird for about an hour or two. You can't eat, you're jarbling words, you're biting your lip just because you're so numb. Now I can do it that way. If you tell me, Con, I don't want to feel any pain at all. I don't care about the numbing procedure. I don't care about how I feel afterwards. I just don't want to feel anything during the process. Then easy. I'll numb the entire face and you absolutely feel nothing, just like if you were at the dentist office. The preferred way of doing it is I like to test it. Give a little bit of lidocaine in places that I'm gonna place the threads, and I'll put in one thread. If I'm in the right place, this is during my treatment or during my educational programs as well, and I tell the providers who are doing this, if you're in the right place, it's gonna be easy for you to place the thread. If you're in the right place, the patient will not be in pain. I always listen to the patient. I educate providers, listen to the patient. If the patient grimaces, if it's hard for you to place the thread, or if the patient tells you they're in pain, likely you're in the wrong place. Now, if I do the procedure correctly, I will still put lidocaine in a couple places because I know how to treat and I know which places I need lidocaine and to make the patient comfortable. But those are the two ways I can help limit pain for you. One, to mess and lidocaine the whole entire face so you're very, very comfortable. Or two, I make sure I listen to you. I go at your pace and I numb according to your pain threshold. Lastly, as a comparison, I get patients all the time that have had threads in other places, whether they've had it years ago, months ago at other facilities. And one of the common things that they always tell me is the reason I haven't done this again is because it was so painful. And I fully understand that. And I empathize with that. I always say, yes, it can be a very uncomfortable procedure, all based on the things that we just discussed. However, if I do the procedure correctly, it will be very, very pain-free or very, very comfortable. Are you gonna feel stuff? Absolutely. It's not pain-free, but it's also within your tolerance. And after they do the procedure with me, they're like, wow, this is no big deal. It's a giant shock to the system. But if you think about it, if you've had a history of aesthetics, whether it's even just this minor Botox or fillers, if you've gone to different providers, you'll notice the difference. One, you're in a lot of pain. Even with Botox, if the provider uses a dull needle or a different type of needle, you'll feel the difference. You'll feel crunching. And if you've done Botox, you'll know some providers, you feel crunching on the forehead. Other providers, you don't, and you don't even feel the needle at all. Same with fillers. Commonplace, lip fillers. Everyone says it's super painful and they don't like to do it. You go to one provider, very, very painful. You go to another provider, pain-free. You switch providers again, and it may be painful again. Because it's not the filler, it's not the needle, it's how they numb the area and how the provider actually does the procedure itself that makes it uncomfortable or comfortable. That's it, guys. So that is another episode of Excellent Medical Spa. And if you didn't click the thumbs up in the beginning, hopefully you saw the whole video and you found this educational and helpful. So if you did, give it a thumbs up and make sure you share this with your friends and family who have been thinking about doing PDO Threads as well, or to yourself. If you enjoyed it, then give it a like. Now, you all love PDO Threads. That was another version of PDO Threads and how it can be very, very comfortable. So don't be scared off by Google. Don't be scared off by the other reviews you see online, because it's not the procedure itself. It is the provider that's doing the procedure for you that makes the biggest difference. I'll see you guys on another episode of Excellent Medical Spa.